How long someone stays in treatment is the key factor to success. In treatment world, we refer to that as length of stay. You need for someone's brain to get clear for at least like 2 weeks before they're even gonna think straight at all. The first week is detox, and sometimes people need medical detox. We'll cover that in another video. The key is getting their brain detoxed, and then that next week is just like an emotional roller coaster for sure. So letting a little teeny bit of that settle out, and the person starts to think a little bit slightly more clearly after about 2 weeks. We are in no way out of the woods here, but you don't even have a glimmer of hope until you get to that 2 week mark. I would say just going to a detox and then doing nothing else treatment wise is a serious waste of time and money. I used to work in a detox center, and people would come in and they would think, okay, I went to treatment, and they would call that rehab. That is not rehab. That is detox. And I mean, seriously, that's like getting your brain to clear so you can even possibly think about getting sober. They don't really teach you recovery skills in detox. They try, but you're usually in a really foggy state. You're sick. You're not clear. So anything they do teach you probably isn't really going to stick. It's going to take more than detox is what I'm saying. You really need to understand that the person is going to need to devote the next year of their life to getting sober. Now, that doesn't mean they need to be in treatment for an entire year. It means that the recovery process needs to be the first most important thing in their life for probably at least the next year. But the key here is having recovery in your life every day. So that can consist a little bit of inpatient treatment, and then some outpatient treatment, and then maybe what's called partial with lodging, which is where you're going to the hospital every day, but you're staying in a recovery house. Meetings, 12-step meetings, all different kinds of community resources. So it's not like you have to be an inpatient for a year, but you need to figure out how to put recovery in your life every day for the next year to really have some good, solid chances at getting this thing. So if you've got a kid or a loved one and you think, oh my gosh, I got them to agree to go to detox, and you think that's going to fix it, not so much. So when you go in this process with your loved one and you're trying to get them into treatment, don't tell them it's going to take the next year. That's a mistake, because they'll be like, hell no, I'm not doing that. Don't tell them it's going to take a year. You just need to understand in the back of your head that it's going to take a while, and you may have to get them to agree to do one step, and then we'll cross that barrier and we'll get to the next step and to the next step and to the next one. But in your own head, especially if this is your child, don't be thinking in your head that you're going to send them off for a couple of weeks or 30 days or even 60 days or 90 days and you're going to bring them back home and it's going to work. If they're gone that long, 30, 60, 90 days, you're probably going to be thinking, oh my gosh, like they're so much better. There's my kid, there's my husband, there's my loved one. Because it's going to be like they're coming back to themselves, and you're going to go visit them and they're going to seem wonderful, and you're going to be so excited. You're going to be excited about bringing them home. You're going to think, finally, we got this thing beat. No, you don't. They're wonderful because their brain is clear and they are themselves. But as soon as you bring that person and you put them back in their home environment, the same old, in recovery we say people, places, and things, or sometimes they'll say playmates and playgrounds and playthings, it pushes the person back into their old thinking. Even if they don't want to go back, it's very, very difficult to stay sober once you transition. It's the transitions where things fall through. So planning for how you're going to go from detox to rehab, from rehab to sober living, from sober living to, going to meetings every day and sponsorship. Those gaps in between are the important parts where you really have to pay close attention, because that's where people fall through the cracks. Thanks for watching my video. If you feel this information was useful and you think it could also be helpful to other people, please subscribe to our channel. That tells Google that the videos we produce are actually informative, and they'll show it to other people looking for help.